I'm Andreea Bujor. I'm from the Scleroderma Center at Boston University, and I'm working on spatial frequency domain imaging as a novel method to quantify skin changes in scleroderma.
Can you describe for us, so for our patient population, so really using kind of layman's terms, general terms, why this project is so promising for people who are living with scleroderma?
Yeah, sure. One of the landmark changes in scleroderma is skin thickening. And this is very important to accurately assess because it not only helps to diagnose patients, but it also helps us predict disease progression. The current gold standard to assess skin thickening in scleroderma is the modified Rodnan skin score. This involves pinching of the skin between two fingers and giving it a score between 0 and 3, depending on how thick the skin feels. 0, the skin is not changed, it's still soft, and 3, you cannot pinch, the skin is very thick. As you can imagine, this technique is not very objective. It really depends on the investigator that is doing it. It depends on their experience, on their training. Our project aims at validating a new technique that would be able to pick up more objectively and more early skin changes in scleroderma patients. This would help scleroderma patients hopefully live better and longer life because it would help them be diagnosed earlier and being offered treatment earlier.
What would you say is a particularly innovative aspect of this project?
In scleroderma, there is skin thickening because of enhanced collagen and structural metrics that position in the skin of patients. The technique that Dr. Roblier developed, my project partner from biomedical engineering here at BU, is fascinating but simple. In this technique, we are using near-infrared light to illuminate the skin of patients with varying frequency of light patterns. There is a camera that captures the optical properties of the skin from a surface of 10 by 10 centimeters up to 10 by 10 centimeters. Specifically, we are picking up optical scattering and absorption coefficient. Because scattering really depends on the microarchitecture of the tissue, we think that it is highly sensitive to the content of the collagen, to the amount of extracellular matrix that is present there. So our technique is hopefully being able to pick up fibrosis in a very sensitive way.
In one sentence, how would you, if you had to kind of boil it down to kind of just one kind of statement, what is the most important question or kind of outcome you want to address with this project?
Is there a more accurate, objective, and sensitive method to detect skin changes in scleroderma from early to advanced disease? This is the question we would like to address.
So how does this work build on work that you've done so far in your career?
Yes. In the initial stages of my career, I mainly focused on studying the molecular mechanisms of skin fibrosis. After I became a board-certified rheumatologist specializing in the care of scleroderma patients, I was inspired by my personal experience in caring for these patients. This project offers me the opportunity to combine both my physician skills and my scientist skills with the ultimate goal of helping my patients, which is the best thing I can aim for.
If you want to share a little bit about what got you interested in scleroderma research.
Certainly, my first scleroderma patient in medical school has left a long-lasting impact on me. But I would say the most important thing that a person that made me study scleroderma is my longtime mentor, Dr. Trojanowska, whom I met by chance many years ago. She's the one who offered me my first research position in her lab, and that continued to inspire me to study scleroderma. And ultimately, also, I have to acknowledge my patients. My patients are really an inspiration to me. They keep me going when things get hard. I'm very impressed with their resilience and with their willingness to help the research in any way they can.
I love that. Thank you for sharing. So what would you consider to be kind of the impact of your research to date?
I think all the research we do, this is a collective work. It's not a small thing or a big thing, because a small thing can build up on someone else's big thing. So I don't feel that any of my research is necessarily more or less important. I feel that everyone's research is equally important. Even negative results are important because it helps someone not go that direction. Of course, my dream is that I would leave something behind that will help patients because that's the ultimate goal in the end. And whether it's directly or indirectly, it doesn't matter as long as it helps science and patients.
So what do you see yourself working on 10 years from now?
I see myself doing the same thing. I see myself caring for scleroderma patients, teaching rheumatology fellows. I see myself doing basic research, translational research, and being a mentor for the next scleroderma researcher.
What do you think are some of the most exciting research directions in scleroderma today?
I think we're living very exciting times. We already have 2 FDA-approved drugs for scleroderma, hopefully more to come. We have developed new ways of assessing patients, selecting them for clinical trials, the most likely patients to progress, the most likely patients to respond to a certain treatment. And I think this is all due to the research that's being done in scleroderma that continues to be done. I'm very hopeful that we will continue to make great progress in treating this disease.
If you had unlimited resources, what problem would you want to solve?
If I had unlimited resources, I would definitely fund scleroderma research, of course, because this is where my passion is. It takes a lot of money to do research these days because techniques have evolved a lot. So I would definitely put this money into research. And I want to say I'm grateful for the National Scleroderma Foundation for giving us a chance to continue our research, to fund us, to be able to do so. One of the things I didn't mention is that we do see differences between patients that have no skin thickening that's visible with the current method. And they are different than healthy controls. So this device is able to pick up subtle changes before they become clinically evident. And I think that's really important because I see a lot of patients that are referred to us too late because they had very non-specific symptoms and they were labeled either that they have nothing, it's in their head, they have fibromyalgia, because the skin thickening is not always evident, even for us. This is a disease where rheumatologists refer to rheumatologists because it's not easy to diagnose. And I think one of the things that our device offers is the ability to pick up these changes early and offer treatment early. Because early treatment is very important. It improves survival. And the other thing that I'm hopeful for this device is that eventually in clinical trials, we'll be able to use it because I think we don't have a good method to assess response to therapy. There could be clinically significant changes that are too small to detect with a modified Rodnan skin score, but our device would be able to detect them. And then hopefully that would lead to the approval of new drugs by FDA. So I'm really hopeful that this is the future of skin assessment in scleroderma. And what we want to do is have like a scanner. We want to make it into a scanner. It will be like you go to the grocery store, you take the thing and you just click on it and the numbers come on the screen. So that's really, and it does not require sophisticated analysis of the results. Other methods like OCT, they had to do really a lot of analysis and post-analysis to get some significance. And the device is really expensive. Ours would be much more cheap once we end up manufacturing the small one. So the first step is validation, but we're also working on designing the smaller device in parallel. And then the second step would be to put it as a secondary exploratory endpoint in a clinical trial. And once that gets FDA approval to be used as an endpoint, then we could just go for it.
That's amazing. So the vision is really for like a handheld device, like scanning device.
Sure, that's many, I would say years and probably a lot of money ahead. But I think there's, once we put it out there, like we're publishing our first paper now And we're going to apply for an NIH grant once we are at that stage. There's already interest from the pharmaceutical companies, but I think everybody's like, we want to see some data first. But I think they will really be interested, and they should be. So there's so many questions. The very early scleroderma, patients, do they start having skin changes also very early that we don't see? There's a lot of research potential here.
I hope you enjoyed learning more about the important work being supported through our peer-reviewed research grants program. We're incredibly grateful to our team of investigators for the work they do to discover the cause, understand the mechanism, and overcome scleroderma forever. The National Scleroderma Foundation is the leading nonprofit supporter of peer-reviewed research in the country. Since our founding in 1998, the foundation has committed over $30 million to scleroderma research. The need to accelerate the pace of discovery in scleroderma is urgent, and we're proud of our leadership role in advancing scientific innovation. Our program prioritizes scientific merit and provides funding for both early career and established investigators. By leveraging the integrity of the peer review process, we can ensure that we are supporting the most impactful science in the scleroderma research community. And when you invest in the Foundation's research program, you can ensure that your resources are being carefully stewarded every step of the way. Thank you for your support of our research programs, and thank you to our investigators for making a difference in the lives of people living with scleroderma.